Good afternoon, everyone, and thanks again for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Minister of Health Jim Reiter. Joining us over the phone line, we have Dr. Denise Werker, Deputy Chief Medical Health Officer for the Saskatchewan Ministry of Health. We also have Scott Livingstone, CEO of the Saskatchewan Health Authority. Premier Moe will have an opening statement, followed by a period for questions.
Thank you very much. Good afternoon, everyone. And we are saddened to report that there has been another death in Saskatchewan due to COVID-19. We're also aware of an additional death that is currently under investigation and may be reported in tomorrow's numbers. And I would say that our deepest condolences go to the families and to the friends of the deceased at what is, we know, a very difficult time. Today we are also reporting no new cases as well as 3 additional recoveries. That is now 16 days in a row that Saskatchewan has had more recoveries than they have had new cases. That means that there are now just 77 known active cases in the province, down from the peak that we had of 209 on May the 10th. 65 of those active cases are in the far north, and we continue to work with our northern communities with just 12 cases in the rest of the province. With the number of active cases so low in much of the province, a number of people have voiced concerns about the temporary closure of emergency rooms in 12 rural facilities. I would say today that I share those concerns. I understand that our health system has had to make some what are very difficult decisions to prepare for the potential and possible surge of COVID-19 patients in our hospitals in communities across Saskatchewan. We have to be ready. But thanks to the actions of Saskatchewan people, our province has been able to avoid the kind of pressure in our hospital system that we have seen in other places of this nation and other areas of the world. As a result, in addition to having the opportunity to reopen our portions of our Saskatchewan economy, we are also restarting elective surgeries and some other procedures that were paused to prepare for the COVID-19 healthcare delivery response. I know that there have been rumors of the temporary ER disruptions that they may be permanent. These are rumors. I can assure the people of Saskatchewan that this is not the case. These are temporary measures. It has always been the plan to reopen these facilities, and the sooner that occurs, the better. These rural ERs will begin to reopen in mid-June, starting with the community of Arcola, and the others will follow in the coming weeks. Earlier today, we announced that the government and the opposition House leaders have reached an agreement for a 3-week modified sitting in the Legislative Assembly, and that will begin on June the 15th. We've agreed that 10 government members and 5 opposition members will be in the Assembly at any one time in order to ensure that physical distancing is in place. On June the 15th, the Finance Minister, Donna Harpower, will table an updated version of the budget that she released on March the 18th. That will be followed by 60 hours of consideration of budget estimates. This will be by far the most extensive scrutiny of any budget in any house in this nation since the beginning of the COVID-19 pandemic. And this is positive. Positive for this province and positive for the people of Saskatchewan. This is a budget that is focused on building a strong Saskatchewan, and it provides the first steps for us to achieving the targets that we set out in our plan for growth. It's a strong budget, and we look forward to presenting it to the people of Saskatchewan, as well as debating it in the Legislative Assembly next month. So with that, I would be happy to take any questions.
Thank you, Premier. We now have about half an hour for questions. We'll take our first question from the phone line. Operator?
We have Kelly Stefano with CTV.
Hey, when could we potentially start to see some limited visitation allowed in hospitals, and what could that process look like?
I will just very high level, and then Jim or Scott, you may want to discuss if and when that could be an option and under what circumstances and parameters that would be able to happen. The limitations that we have, we know these are difficult decisions, and there's been some difficult decisions that have had to occur. But we know across this province, not only in hospitals but in long-term care centers, much of the resulting fatalities due to COVID-19 have come from precisely those facilities. So there are people in our hospitals, in our long-term care facilities that are very vulnerable to the effects of COVID-19, and we have taken measures to ensure that we are able to protect the most vulnerable in our society, many of them in hospitals and long-term care facilities, to ensure that this virus does not come in contact with them. We're taking every measure to prevent that from occurring, but they are challenging decisions, and if there is an opportunity for that to occur, we would continue to look at it, but we need to ensure that we are able, in many cases, to keep this virus out of those facilities. We have seen what happens when it gets into a long-term care facility or multiple. We have seen what happens just here in Saskatchewan when we have the virus introduced into our hospital facilities, where we have 60, 70, 100 hospital workers that need to be quarantined for up to 2 weeks, and that is precisely the capacity that we need to draw on from time to time, and that's precisely some of the reason behind some of the very difficult decision that we made in temporarily altering the services at a number of our facilities across the provinces, so that we had that type of capacity to address some of these outbreaks that we have had, and to train, quite frankly, our staff in the proper handling of the COVID virus when it does get into those facilities. So you want to speak, Minister, just a little more specifically if and when we could look at having visitation in our hospitals or long-term care facilities?
Sure, thanks, Premier. I'll make a couple of comments, and I'll ask Scott to add on as well because of some conversations that he and I have had lately. I would just add to what the Premier said. We do allow, of course, visitation and for extremely compassionate reasons, but we do recognize that there's instances in long-term care facilities, especially where frankly, seniors are lonely and it's very difficult for them, and we don't want to have them in that situation any longer than necessary. So Scott and his senior staff are looking at possibilities right now of what we could do to potentially, while making sure that safety is paramount for the reasons the Premier said, that loss of lives in many of the provinces are in long-term care facilities. We want to make sure that doesn't happen here, but we recognize how desperately many patients in hospitals and seniors in long-term care facilities would like visitors. So with that, I would just ask Scott to comment on the work that's been done in the last little while on that.
Thanks, Minister. So just to highlight some of the things that are happening in respect to both long-term care and acute care and other facilities where we're looking at expanding the opportunity for patients, families, and level to visit is we've recently established a family presence expert panel, which has significant involvement from patient and family advisors within the SHA to provide us some guidance on new recommendations to support family presence across our facilities at the time we're dealing with COVID-19. This group of folks, our expert panel, we hope will develop much more consistent and timely guidelines around how patients are visited by family and loved ones. The panel's meeting weekly as we speak and taking action quickly. We're going to be making some amendments to that definition of compassionate reasons for visit, because we think we can expand that without actually changing the public health order. The hope is that we will be bringing this forward to ministers for decision, and we'll look for implementation of a phased-in strategy during the first week of June, so starting June 1st of this month. So we hope to see that lift some of the restrictions to go beyond compassionate care, which is where we are today, but also balance the safety of our long-term care residents and other patients throughout. And we are still working on other ways to expand visitation, as you know, through the use of virtual visits. But we also know at this time that from the feedback we're getting across the province that simply isn't enough, and you'll see some changes the week of June 1st.
Follow up, Kelly?
Perfect, thank you. And yeah, I do have a follow-up. There's a bit of confusion right now over the age of the 8th person who's died of COVID-19 in this province. So, of course, the SHA is saying the person who is in their 50s, of course, this is the 8th death. But meanwhile, the family of this person is saying she was 64 years old. I just want to make sure we're all on the same page.
We'll turn that over to Dr. Werker on the line.
Hi, yes, it's Dr. Werker on the line. I just want to acknowledge that you're hearing a different voice than what you would normally hear in terms of Dr. Shahab. So I am confirming that there are 8 deaths. We have one death in an age range from 40 to 59, 4 deaths in a range from 60 to 79, and 3 deaths in individuals who are 80 or older. So the 8th death that is reported today is a person in their 50s and is from the far north.
Okay, so maybe is the possible 9th death, do we know the age of that person? Because the family is saying 8th death, the victim is 64.
Yeah, I'm not in a position to disclose any information about this death until we actually have it officially reported to us. I anticipate that we will have that information tomorrow.
And Callie, I'll refer you to the news release where it mentions an investigation is ongoing for a potential 9th death as well. We'll take our next question from the room here. Arthur?
So, in terms of the rural hospital kind of temporary ER suspensions, clearly that struck a nerve. And I just want to ask whether you think that either the government or the SHA made a mistake in the way that was handled, and who, if so, who is ultimately responsible?
I would just quickly say there's concern. There is some concern out there with respect to these closures, and I won't try to preclude as to all of why that concern is there. Outside of some of it may be that there is a perception that these could be permanent closures. That is not the case. These have never been intended to be permanent closures. They've been a temporary closure to allow the health authority, the Saskatchewan Health Authority as a whole, transition into a more holistic response to a COVID-19 surge if we should have it. Thankfully, the position that we're in Saskatchewan, and this is due to what Saskatchewan people have done as individuals, is we are not experiencing any of the modeling numbers that were first brought out a couple of months ago here at this point in time. That's not to say that there couldn't be surges as we move forward, and we need to be prepared for that. So these are decisions that have been made. They have been temporary, always been deemed to be temporary in nature, and we look forward to reinstituting these services sooner rather than later. And as we said, that's going to start about the middle of June in Arcola, and then it will expand to the rest of the sites in the weeks after. Jim, do you have anything to add to that?
Sure. I would just add that I'm a small town kid. I'm very protective of the services that we have, and a lot of people feel that same way. And you know, to your point, I guess probably if there was some confusion about whether it was temporary or not, probably we could have did a better job in communicating that. I think we've absolutely clarified that today. There was concern, as the Premier said, I think with some people that the closure of the ER would become permanent. That's not the case. And I think the fear is stoked from there that potentially some of the facilities would be closed. That's not the history of this government. That's not the case with any of these facilities. Those ER closures are temporary, and over the next number of weeks, you'll see them reopen.
Follow up, Arthur?
Was the decision to reopen them completely consistent with the health advice that you're getting from the SHA, and what role did the political pressure that you're facing from some of your constituents play in making the decision to accelerate this?
I would say, and Scott Livingstone might want to comment on this as well, but we had many discussions about this starting before the announcement of the actual temporary closures. This was according to the plan all along. We didn't know exact dates, and we don't, in most of the cases, we still don't, right? Work has to be done. But the decision all along was to close them for all the reasons you've heard, so that staff could be trained, to free up capacity, to make sure that cohorting is done in those facilities that are both long-term care and acute care, for all those reasons. So this I would say is according to plan. As far as dates, we never had dates in the first place, just tentatively saying that, you know, in the next number of weeks and months that they'd be reopened. So I would say it's fair to say that that this was the plan all along. Scott might want to add to that.
Sure, I'll just add a little bit around the plan process for the reopening, as well as sort of the thinking initially is just to remind folks that the original plan was to create 12 COVID-free facilities within these 12 designated facilities, as we were working with other integrated facilities that had both acute and long-term care across the province to ensure we had staff training and cohorted staff and other things to deal with potential COVID surge, but also at the very same time to protect those residents in long-term care and separate the staff so that we weren't cross-contaminating if COVID or asymptomatic COVID patients came into these facilities. Because the designation early on in these 12 was COVID-free, we haven't done that work. So that's that work that is going to be undertaken now as you see those temporary closures or temporary suspensions of services be withdrawn, and that, as the Minister and Premier have already said, will occur over the next 4 to 6 weeks, starting with the Dakota facility.
I would just end with saying I understand there may have been some confusion in not being clear about the temporary nature of these rural healthcare facilities and the action that's been taken there, but it is temporary. I understand it fully, though, the concern. I've been through this in my community in years past. Many communities across the province have, as we have struggled over the course of the last 15 years or so with access to medical health care professionals in rural Saskatchewan, and there is community after community that has had challenges with breaks in services, and the concern always is immediately, we had the same concern where I live, that it's going to be permanent. That's not the record of this government, though. This is a government that has not only invested in rural healthcare facilities, and many of them in an unprecedented fashion, and we're going to continue to, including in many of these facilities over the course of the next few weeks. But this is also a government that has invested innovatively in how we can staff those facilities with medical health professionals through what started as a physician recruitment agency of Saskatchewan, went on to be a SAS Docs, the whole effort around recruiting physicians from beyond what was originally the 7 Commonwealth nations. The efforts in expanding the training at our University of Saskatchewan, expanding the training for nurse practitioners and the scope of practice for nurse practitioners. The record of this government is to invest heavily in the health care that's being provided in our rural communities and our urban communities. It's a record that we're proud of, and it's a record that we are going to continue with in as long as we have the opportunity to serve the people of this province as their government.
We'll take our next question from the phone line.
We have Murray Mandrick with the Leader Post.
Good afternoon, Mr. Premier. Can you expand a little bit, perhaps, on how the session budget might look? Will we now see a full budget with revenue and expenditure projections formally presented in the legislature? Will it be followed by the usual budget speech address, or will there be sort of limits on estimates? I was, perhaps even your own Premier's estimates that are less specific to the actual spending in your department or than otherwise. How do you envision this to look once we return to the House?
Well, I think I envision it to look very similar to, but different than what a normal budget process would look like. There will be the introduction of the budget, both the estimates, which will be based largely on the estimates that were made public on March the 18th. However, there will be some additions to that with respect to the self-isolation support program, for example, or the small business emergency grant that we had put in place, or some examples. The infrastructure investment that we have would all be examples that have been updated and clearly communicated with the public. That will be part of that budget, as will be our best estimate with respect to revenues that the Ministry of Finance can put together. And we've already had one update from the Minister of Finance on 3 different revenue scenarios that may be there. In saying that, what we are going to experience this year is a pandemic deficit. We will have a deficit this year due to the COVID-19 pandemic. That deficit will be largely attributed to a lowering of the revenues, and that has been indicated and communicated by our Minister of Finance already. Our spending estimates that were for for the most part, remain intact. Our ministries have done a very good job of ensuring that the investment that they were allocated, the 5/12 of the year that was allocated to them through the special warrant, they are remaining projected to operate, including health, to operate within the estimates that they have been granted. So the budget really will be based off of the budget that was made public on March the 18th, with some of the adjustments that have been discussed since that time that have been directly put forward to address the COVID pandemic. $56 million the other day, the special warrant that was put through. Over $53 million of that is from the federal government, but goes through the provincial provincial accounting system, and that is the wage subsidy that we are making available to the people of this province. So all of that will be included in this budget, but it will all be built off essentially what was tabled on March the 18th.
Follow up, Murray?
Yeah, I got lots of them, but I guess I'm limited to one. A couple federal issues. In relation to what BC, Manitoba, and the Yukon improved in terms of the 14 sick days, are you going to follow that lead? And in a similar vein and related to federal issues right now, the nursing home issue, it's obviously not as big a deal in Saskatchewan as we haven't had the specific problems that they've had in Ontario and Quebec, but there was a time not long ago when the CEOs would travel and visit nursing homes to identify similar problems and concerns. Are we going to be addressing those two national issues in any way, shape, or form?
Sure. Well, first and foremost, I'll answer them in reverse with the second one first. The quality of our seniors' home. Jim, you may have something to add on this one as well. We're very fortunate in that we have not had the same discussion, the same issues to date with our either our public or our private long-term care homes here in the province of Saskatchewan, and I would say that's attributable to a number of reasons. But first and foremost among them would be the staff that are working in our long-term care homes, whether they be private or public here across the province. They go above and beyond each and every day in ensuring not only are the residents cared for properly, but the actual physical building is kept clean and kept up to standards that not only those residents would like to stay in, but their family would stay in. So my true thanks goes to all of those folks across this province that have put their careers into the elders in our community and caring for our families, loved ones. It's appreciated so very much. We have also in this province a very vigorous regulatory system for our long-term care homes to operate within, and we can be thankful for that, particularly thankful for that over the course of the last number of months. And last but not least, we have and continue to invest in our long-term care homes, both in rural and urban settings, invest in the infrastructure, invest in the individuals that are working and serving our family members in those homes. We've had a number of long-term care centers that have been replaced, more coming in the days ahead as we introduce another budget here in the province, as well as we've invested heavily in the refurbishment and the upkeep of our healthcare facilities, long-term care homes, hospitals across this province. And you're going to see more of that in the days ahead with the infrastructure commitment that we've had. Jim, I'll maybe turn it over to you, and then I'll do the self-isolation or the sick pay.
Sure.
Piece.
Thanks, Premier. I would just add on the long-term care facilities, Murray, your comment about the CEO tours. And I'll get Scott to comment on this as well. Those tours continue. They've continued since the amalgamation of the health regions. They in some years will look different. It might not, obviously, because of the size of the province, be just the CEO doing those. It might be vice presidents involved. But, we see the value in that, and those continue. Scott, do you have any comments? And again, with COVID now, I'm not sure how much of a disruption that's going to be. Obviously, they haven't been ongoing for the last 2 or 3 months. Scott, do you want to just elaborate on that?
Just to confirm what the minister has said is those CEO tours have continued, but it hasn't just simply been me touring our multiple facilities, our executive team. We split it up around 5 to 6 facilities per team member, and at the time we do face-to-face visits with long-term care facilities and actually meet with the resident councils and the family councils to hear from them directly on the issues that they may be having within facilities, some of the things around, food quality and some of the general upkeep things, but often it's around what they're experiencing from a care perspective or things that they like to see. So those are all reported out by the team annually. Again, to Minister's point, not sure what that's going to look like in a COVID environment. We certainly don't want to put long-term residents at risk with visits from administration through the summer, but we are thinking about what we will do. But we have carried that on since amalgamation and expect to continue to do so.
On your first question, Murray, with respect to BC, Yukon, Manitoba, I believe they've signed a joint understanding to, I believe, ask the federal government to step into the space of sick pay or ensuring that people that are feeling a little under the weather, in particular in these times of COVID, as we go into the fall, as we enter regular flu season, that people choose to stay at home and can be compensated for staying at home when they are feeling under the weather. This is an important conversation. It's been raised at our Council of Federation table for a couple of weeks now, as well as the First Minister's calls, the weekly First Minister's calls that we've had, and I expect it'll be a topic of discussion this week. Saskatchewan is in a little bit of a unique situation, along with the Yukon and maybe one other province with respect to very early days of addressing this pandemic. One of the first initiatives that we had put forward was a self-isolation support program, where if someone did not qualify for any other programs and was feeling under the weather or required to self-isolate, we would compensate them $450 a week for up to 2 weeks, so a total of $900, to ensure that they didn't have to make the decision between having some degree of income and self-isolating. So Saskatchewan is somewhat unique relative to other provinces where we have had a program in place, and it's been in place for a couple of months now, and I think it's been effective where it has been utilized.
We'll take our next question from the room here, Steph.
Yeah. You both acknowledged the struggles that some rural communities have had when it comes to seeing their healthcare services be there as they required it. So given that, how did you not foresee how sensitive people would be to a temporary closure of an ER? We hear, Minister, that there's been an admission that, maybe it could have been communicated better. These aren't permanent, these are temporary. But how did you not foresee how sensitive people could be around this and the fact that it would hit a nerve?
I would think, when we did the original communications, the SHA staff did a news conference on it, the news releases that went out, everything referred to it as temporary. And mistakenly, I guess we thought that would be enough and people would realize. I think most communities that was the case, but obviously some people were concerned about it, and we need to clarify it.
I would say there's been some very challenging decisions that have had to be made over the course of the last couple of months, and this is among them. To temporarily shutter the services in rural communities, understanding the sensitivities, being through it myself in my own community over a decade ago. It isn't underestimating the sensitivities that are there. And I don't think anyone should question the commitment of this government to rural health care. Our record speaks quite differently, speaks to a much different priority. And you'll see in the days ahead as well that commitment to rural health care will continue into the future, including to these facilities here as well. So I don't think it's that we have not foreseen or in any way thought that this would not be a sensitive decision. This was a very challenging decision, but it is one that it was necessary in order for us to ultimately prepare and address our response to COVID, what could be coming at us from a healthcare delivery needs perspective, but also to train all of the individuals in these particular facilities as well as other facilities, and to provide that that ability to backstop the effort that we need when we, for example, have an outbreak in Lloydminster, Prince Albert, and we have 100 healthcare staff that need to self-isolate for 2 weeks. We need to have that type of capacity. We need time to transition our healthcare services from a training perspective into how they are because it's a new normal in our healthcare facilities, just like it's a new normal in our everyday life. So there's a number of changes, cohorting of staff so that individuals are working in one facility, not 2 or 3, so that we can minimize any outbreaks if they should occur. And we have had outbreaks in both hospitals and long-term care facilities, and we have been able to contain them. So what we are doing from a COVID perspective is working. It's working in the general public, and it's working in our healthcare system. This was a very challenging decision with many sensitivities around it, but it's a temporary decision, and we'll be moving forward with the full implementation of services in these communities starting on June the 15th.
Follow up, Steph?
Yeah, the time frame we're looking at now that, June 15th is when at least one of the facilities is going to be open. Then I think if I heard correctly, it's going to last for about 6 weeks. And by the end of that 6 weeks, all should be up and running again. Was this always the original timeline for how long these would be temporarily closed, or is what we're looking at today a bit hurried up or changed, just given some of the concerns you've heard?
I'll make a couple comments, Jim, and then you go where Scott may go. There hasn't been any original dates. It's not until now, and this is where maybe some of the confusion is, and this is on me. This is where maybe some of the confusion is we just haven't been able to ascertain the time frames up until now because of the training that's happening, because of the transition into the cohorting of staff that is happening. It hasn't been until now that we've been able to actually ascertain when we can actually start to reopen these facilities. And in that, I can see in hindsight that there is at times confusion. There is at times, the onus is on me to communicate better that these are not being considered for permanent closures. These are temporary. These facilities will be reopened, and this government will be making every effort to ensure that can occur.
I would just add, and then Scott can if he likes, to the Premier's point, all the briefings I was in that this was discussed, we spoke of it in general terms, things like early summer, those sorts of things that they would be reopened by. So the Premier's right, we didn't have any particular date set because, and that's for a very important reason. There's a number of things that need to be done. Staff need to be trained, staff need to become familiarized with the larger center that they could potentially be working in if we have too many COVID cases. In some instances, I believe they're going to have to do actual construction work in the facilities to separate the long-term care from the acute care, and staff need to be cohorted. So at the time that the plan was implemented, as other parts of the plan, we didn't have precise exact dates because all those things can vary. Scott, did I miss anything there?
No, I think you spoke to everything that I would have spoke to, in particular that just the time frame was being driven by how we safely bring those services back by making sure that we can cohort staff, make sure the staff have been trained to deal with COVID patients, because that's one of the missing pieces here. Unlike the other facilities that were designated COVID at the start, these ones weren't. So that safety process has to go through the staff. We have to do that cohorting and make sure that we actually keep those 402 souls in long-term care in these facilities safe. And the minister spoke to many of the criteria being used and the training that's going to be required.
This is a government that is committed to offering services both in rural and urban Saskatchewan. That is our track record. That will continue. This is also a government that is committed to ensuring that we are prepared for whatever healthcare services may be required should we have a larger outbreak than what we've experienced thus far. Ensuring that we have the capacity at the testing, the contact tracing, the isolation perspective, comfortable that we have the capacity to deliver the healthcare services that may be required. When that is in place, and it is in place now, that is what enables us to actually start to reopen up sectors of our economy, reopen up some surgical capacity in our healthcare system, and carry on with what is a new normal both within our healthcare system, within our community, and within our economy as we move through the next number of months until such time we can ultimately have access to a vaccine. And it looks like we may have a very local entity in Vito Intervac that is well on its way to developing that on behalf of the people of this province, this nation, and the world.
We'll take our next question from the phone line.
We have Roberta Bell with Global.
Hi, my question is regarding the rural ER closures and the alternate level of care facilities. I was just wondering, in the past 2 weeks, what exactly has been going on in these facilities? Has it purely just been training and cohorting, or have you been helping patients as it was intended to be?
I'll just start and I'll ask Scott to be more specific. It depends on the facilities. A number of them, I believe, would have had ALC patients transferred in from larger centers. As far as the training, I believe it's underway in some of the earlier ones that were closed. Scott, do you have more specifics with you?
Those would be the two big highlights. So the biggest component of the question is how has the facilities been used for their intended purpose? And the answer is yes. One is to keep our long-term care residents safe and making sure that we're not using or having asymptomatic COVID positive patients walking into them. And the other one is, as ministers mentioned, is using them for ALC patients coming out of other centers and building some bed capacity.
Follow-up, Roberta?
Have we seen any changes in demand for emergency rooms and what would be the hospitals that they would be having to travel to? Have we seen an influx in rural patients coming to larger urban centers because of this?
ER rooms in general have been very quiet since this happened, to the point that it's causing some concerns in some cases that people are staying away that potentially should be going. I don't know as far as specific tracking, if we have any numbers available right now, rural versus urban. Scott, are you aware if we have those?
No, I'm not hearing even anecdotally about increased volumes in other sites as well. That would be concerning, but to the minister's point as well, we know throughout the COVID response we have seen lower attendance to our ERs, not just in the large urban centers, but across the province. And we see that changing as the system is starting to resume services, but we still are not seeing the tight same load of patients that we were seeing pre-COVID.
We'll take our next question from the room here. Karen?
When these rural facilities, the ERs are reopened, do they stay open or could they be closed again if we see a surge? Like, I can't remember that part of the plan exactly.
If we did see a surge that we had a huge drain in the system, potentially they could. Again, it would be temporarily. If staff in those facilities would be needed to cover off in facilities where COVID patients would be staying. But again, I would just reiterate that would be temporarily. Our numbers have been very good. We're very optimistic it won't happen at all.
It wouldn't necessarily then be all 12 closed. It could be 1, it could be 6.
It would depend on sort of the demands on the system at that time.
I would point, that isn't expected. With the testing, identifying, contact tracing, isolation efforts that we have, and that's really where the efforts are as we move forward. And we've seen the federal government is coming squarely in behind the provinces on how do we support not only testing but contact tracing across interprovincial borders to ensure that we're able to identify these cases far before they become a provincial pandemic or a national pandemic, and isolate them to a specific facility or a community. And if we continue to be able to do that, and we have been able to do that time and time again here in Saskatchewan, if we continue to be able to do that, and I believe that we can, we will not have a provincial pandemic. We will have these regional outbreaks that we need to ensure that we react to very quickly, so that we don't have to alter not only the services in these 12 facilities, but again alter maybe our surgical capacity if we're able to get it up to a certain level, to have to pull that back. So there's a lot of effort that goes into that front line of identifying the cases early, ensuring that we can trace the people that they've been in contact with, and then isolate those individuals. This is why we are moving to expanding our testing criteria, is so that we can catch any of these cases sooner rather than later. You know, people talk about a second wave of COVID-19, and I would say that in Saskatchewan we have been fortunate for a number of reasons, in that we have not had an infection level that has been comparable to some of the harder hit areas in Canada and North America and around the world. I would place much of that success on what people have done in this province, in their physical distancing, in their hand hygiene, having virtual visits with their family that are in long-term care homes, which I know is very, very difficult. These are the reasons that we are having success in this province. And if we continue to do what we have been doing for the next number of months, we will, and we have proven that we are able to control the spread of this virus.
We'll take our next question from the phone line.
We have Adam Hunter with CBC.
Hi, I have a question about the deaths and the reporting of the deaths that have been happening. Why are we not being more specific about where these deaths are occurring? It would be better for accountability for the public, and we wouldn't say there have been a rash of, let's say, homicides in the central region of the province. So why aren't we disclosing where these deaths are occurring?
I'll ask Dr. Denise Werker to take that question.
Hi, so it's Denise Werker speaking. So the deaths by area actually are available on our website, so that you can see that they are reported by region. So there have been 2 from the far north, 2 from the north, 1 in the central area, excluding Saskatoon, 2 in Saskatoon, 0 in the south, excluding Regina, 1 in Regina, for a total of 8. We don't provide any other personal details about this because these data are collected under the Public Health Act, and there are considerations in terms of how this information is disclosed. And we would only disclose information if it served a public health purpose. We need to protect the privacy and confidentiality of individuals if it doesn't serve a public health purpose. COVID-19 is a respiratory disease. It's transmitted, as you all know, from droplets, from coughing, sneezing, and talking, or by direct contact. And so, providing further detail on the exact geographic location of an individual who died doesn't protect the health of individuals. Everybody needs to take precautions.
Follow up, Adam?
I'm wondering when we are going to expand our virtual households to more than 2 or 3, given all the things that are opening in phase 3 and the contact that people are going to have when churches reopen, restaurants and bars, that sort of thing.
We'll direct that question to Dr. Werker on the line.
The guidance of expanding households to 2 or 3 is in keeping with what the average size of families is, and the current guidance on the size of mass gatherings. So the bubbles that people keep, well, it should be in keeping with the maximum size of mass gatherings. The important thing in terms of those bubbles is understanding who your contacts are, so that if there is somebody who becomes infected, the contact can be rapidly identified and contacted.
And we'll take our last question from the phone line.
We have Lisa Schick with CJME.
Hi. In the release, it talks about that the potential, 9th death, it needs to be confirmed. It needs to ensure the case meets the criteria. So I'm just trying to understand what the holdup is on reporting that. So what is the criteria that needs to be met for a death to be counted or official?
So I'll address that question. Again, it's Dr. Werker. All of the deaths that are reported are persons who have had COVID-19. The death may or may not be a contributing cause of death. We are simply reporting all of the deaths. The delay is in relation to having that death, the public health follow-up on the individual, having it put into our information management system and generating that result. So I'm aware that local public health has entered that death into the information management system. but that data entry was not put in before the numbers were finalized for today.
Follow up, Lisa?
I'm just wondering why the system is that we record cases in the areas of the province where the person's home address is instead of the person's current location, because today there are 0 active cases in Regina, but there is someone receiving inpatient care in Regina. So I'm just wondering, isn't that a little misleading doing things that way?
We report the cases and the deaths by place of residence, and that is a standard practice, not only in Saskatchewan, but also across Canada. In fact, there was a conversation today at federal, provincial, territorial tables about the standards around reporting cases, recognizing that people acquire disease, not necessarily in this province, but that in fact is where they're counted. So if there is a risk in terms of where that person has acquired disease or has contact, public health follows up with that, and that risk is managed. If a person who is a resident, let's say of Saskatoon, ends up being related to a contact investigation in Regina, and that event, let's say, caused a public a risk to the health of the public, that event would be put in the public domain. So again, we disclose information to the public depending on the risk.
And that concludes our time for today. Thanks for joining us, everyone.